What exactly is public health? According to the American Public Health Association, public health promotes and protects the health of people in the communities in which they live, learn, work, and play. Some of the aims of public health are to track disease outbreaks, to prevent injuries, and to shed light on why some people may suffer more than others when it comes to health. Today I'm going to be focusing on type 1 diabetes because it's a disease that I've grown up with, I'm familiar with, and I just want to bring more education around that issue because other people in my community are being affected by it as well. There's this misconception where people think that diabetes is caused by either eating too much sugar, being overweight, and there's this idea that if you are diabetic, you can't eat sugar, you can't eat certain things, but that's not the case. It's way more than that. Type 1 diabetes can actually be caused by genetics and unknown factors in the environment that can trigger this onset and response. So type 1 diabetes formerly was known as juvenile diabetes, and it's when the body does not produce insulin. When you eat food, sugars and starches are actually broken down into simpler sugars known as glucose, which is then used for energy. And insulin is the hormone in the body that is responsible for getting the glucose into the bloodstream to the rest of the body. Individuals like myself can actually get access to insulin therapy and ways to control our blood sugar so that we can live healthy lives just like anybody else. While you're able to look into a fraction of what a diabetic's life may look like, I just want to go in and explain why this is a public health issue. In 2015, approximately 1.25 million American children and adults had type 1 diabetes. About 5% of the population living with diabetes has this form of the disease. And there's still this notion that diabetes isn't that serious, but it still remains to be the 7th leading cause of death in the United States. And as far as Massachusetts goes, people with diabetes have medical expenses about 2.3 times higher than those who don't have diabetes. Diagnosed diabetes costs an estimated $7.6 billion in Massachusetts every year, which comes with serious complications that include heart disease, stroke, amputation, kidney disease, blindness, and death. While the diagnosed individual is directly affected, so are friends and family due to the costs and burdens of this disease, as well as the fear of not living a healthy life and coming across complications as we age. In 2015, diabetes was mentioned as a cause of death in 252,806 certificates. Yes, there are different types of diabetes that are involved, but it just goes to show that diabetes is a public health concern. It's affecting so many people, and something needs to be done about it so that people can live longer, healthier,